I've got 1:30. I'll call this meeting to order of the General Fund, House General Fund Committee. And Ms. Hooper, if you will, call the roll, please.
Representative Reynolds.
Here.
Representative South. Representative Hall. Representative Blackshear. Representative Bracy. Representative Easterbrook. Representative Kitchens.
Here.
Representative Lamb.
Here.
Representative Lee.
Here.
Representative McCampbell. Representative Mooney. Representative Sorrells. Representative Sales.
Here.
Representative Warren. Representative Witt.
Here.
Go ahead.
Thank you, Ms. Hooper. We're a little light-handed today. We've got several in the Senate, and will hopefully join us shortly. And we've got 2 out today, and 1 out with the surgery. So we appreciate everybody else that showed up here. Ms. Hooper, if you'll call the first bill on the agenda, please.
House Bill 389, 988, Suicide and Crisis Lifeline, Alabama Crisis System of Care created, Department of Mental Health authorized to administer system and adopt rules, Alabama 988 Crisis Care Fund created, collection of surcharges provided for, 988 Commission created.
Thank you, Ms. Hooper's committee, HB 389. I do want to make a few quick comments, and then certainly we have a public hearing today. And we'll move through that, and I'll give some direction about that at the appropriate time. You know, I see Senator Groger over here. Sir, thank you for being here. Our Senate sponsor, certainly appreciate his passion for mental health. You know, one of our own, Matt Simpson, served on the 988 Commission. And I'll tell you, I've said this several times on briefing this bill. I think back about when Speaker Ledbetter went over to Atlanta and spoke to not only a national but an international conference there, and talked about what our mental health department and this legislature has done over the past 4 years, committing an additional $130 million above and beyond the mental health budget to create the crisis care centers throughout Alabama. As you know, we have 4 open now throughout the state. In addition to that, we have 13 of our mobile crisis units. In addition, we have stood up the 988 line that quite frankly augments the lives that are being changed and saved through the work on mental health, and we certainly applaud that. I think that when Commissioner Boswell came and talked to us about this legislation, I applauded her, because I think we're looking forward on how we maintain that structure going forth years to come. Not years like this year with a big healthy budget, but the years when we begin seeing the budget change. And I think it would be a shame for all the work that has been put into this over the last 4 years. You know, We've also passed legislation. We increased the number of hours for our police officers in dealing with those in needing crisis care. We changed the involuntary commitment law to better support what our professionals are doing at our crisis care centers. And it would certainly be a shame in the future to have to shut those doors. I think every one of our crisis care centers has been full by the day they're open, literally. And so we are in crisis, no different than when some in this room worked on the 911 legislation, and we had a crisis on our increasing number of calls for service to our public safety. So I applaud this system set up for the long-term funding. Certainly this bill would also provide a study commission as an oversight commission of that funding. And of course, as you know, you read in the bill, so this will not be allocated each year by the legislature. It'll be transferred to the Treasury Department so that we maintain throughout future legislative bodies, regardless of what that looks like going forward or the condition of the general fund. I think we'll talk about a sub. I think we've had some 17 or 18 amendments that supported that sub to get us here today. I appreciate many of you that sat out here that worked with us and was at the table and adjusted that bill and continue to have open dialogue today and after today. So with that said, we'll move into the public hearing. And I think, let's see, we've probably got about 9 people signed up to speak on the bill. And does the committee have any questions or concerns before we move forward? All right, I'll ask you to, and I ask Ms. Hooper to limit you to 3 minutes on your conversations, and if the conversation becomes redundant, and maybe the person in front of you just pretty much said what you were going to say, then I would certainly appreciate you stepping up there and maybe hold that to a minute or two so we can move on. We've got a lot of House and Senate bills to deal with today as well. Okay, I'll do it. Thank you. Sorry about that. Okay, first on the list, Commissioner Kim Boswell, Alabama Department of Mental Health. Welcome, Commissioner.
Hello, thank you. Thank you for the invitation to be here. So every 11 minutes, someone in the United States takes their life. Equally alarming is that suicide is one of the leading causes of death among young people ages 10 to 34. In Alabama, 65,000 children experienced a major depressive disorder this last year. There is a new way to get help immediately, launched by Governor Ivey and the Alabama Department of Mental Health with strong support from the Alabama legislature. Alabama's crisis system of care is a continuum of mental health care crisis services that is transforming our crisis response. Unfortunately, these services are not available in every community in Alabama. It is time for every Alabamian to have access to crisis services. The Alabama 988 Act would establish the Alabama Crisis Care Fund so that everyone can have access to someone to call, someone to come to you, or somewhere to go if you're in crisis. Since July 2022, 988 has served as the new 911 for behavioral health crisis services in Alabama. In less than 1 year, 988 has received more than 34,000 contacts. These are children and adults in need of help. These numbers continue to grow every day. The Alabama 988 Act funds the crisis system of care, similar to how we fund 911 in Alabama and nationwide. A simple 98-cent monthly surcharge will be added to phone lines. These funds will ensure that 988 call centers are fully staffed. It will add more crisis centers, and it will grow the number of mobile crisis teams statewide. The Alabama 988 Act will help to relieve our law enforcement officers and hospitals from the void that they have been filling for far too long. So often when people are in a behavioral health crisis, they dial 911 because they don't know who to call or where to go. Law enforcement is vital to our public safety, and they see firsthand every single day individuals going through a crisis who need a mental health response instead of a law enforcement response. In just 1 year, our crisis center served over 2,100 individuals. Of the individuals served, 412 were people who were suicidal and went to the crisis center. 469 avoided jail, over 1,500 avoided the emergency department, and 140 were dropped off by law enforcement at a crisis center instead of jail. Imagine if every community had these life-saving services. 988 saves lives, access to care saves lives. The Alabama 988 Act would ensure everyone has someone to call, someone to respond, and somewhere to go. Lives depend on it. Thank you.
Thank you, Commissioner, and thank you so much for all that you do. We appreciate you. Next up is Jake Lestock with CTIA.
Good afternoon, Chairman Reynolds, members of the committee. My name is Jake Lestock, and I'm here today on behalf of CTIA, the trade association representing the wireless communications industry. Thank you for allowing me to testify on HB 389 in this important issue. CTIA and its members support the designation of 988 for the Suicide Prevention Lifeline and have implemented network changes in order to ensure that Americans can call 988 when in crisis right now. The wireless industry also understands that there's importance of a workable state 988 funding framework. However, most states have been pursuing alternative avenues rather than imposing a new tax on their residents. Furthermore, no states have proposed or enacted taxes as high as the taxes proposed in HB 389. In the past 2 years, over 30 states have proposed to either appropriate general fund revenues and utilize federal funds or study the issue further. Only 5 states have chosen to fund these services through a new tax on their residents, and most recently being in California with a tax of 8 cents. HB 389 proposes a minimum new tax of 98 cents per line per month, not to exceed $3. Even if the lowest proposed tax rate were implemented, 98 cents would be the most expensive 988 tax in the nation, and more than double the next highest tax of 40 cents per month in Washington state. Per line taxes are very regressive, imposing proportionately higher burdens on low-income families, especially those with multi-line accounts or family plans. Alabama already has the 5th highest 911 tax in the country at $1.86 per line per month, and adding $1 or more to that may and likely would add significant burden. To be clear, while CTI believes the general fund revenues are the most appropriate way to pay for the 988 program, CTI does not oppose the use of 988 taxes to pay for the direct costs associated with 988 call centers. If the state determines a tax is needed, we look forward to working with the committee to address allowable uses of the fund and to ensure effective collection and administration of the 988 tax. For example, CTI recommends funds from a 988 surcharge to be limited to funding equipment, communication services, and direct costs for crisis center personnel and 988 call routing and appropriate call taking. The 988 system has often been compared to 911, and those taxes only fund government-operated public safety answering points. They do not fund police, fire, EMS services that send out to crises. CTI would ask that 988 funding be approached in the same manner, and any tax should be limited to the crisis call centers. In closing, CTI would encourage Alabama to choose general and federal funding to support the 988 program, as most other states have done, given their significant budget surpluses, before imposing a new tax on their residents. We look forward to working with you all to ensure successful implementation of this important resource to help our fellow Americans in need. Thank you so much for your time.
Thank you, sir. Next, Sandra Lucas, ADVA.
Good afternoon, everyone. Thank you for this time.
Welcome.
I'm going to ask you to remember a number. The number is 1-800-273-8255. I'll come back to that in just a moment. I represent 400,000 veterans in Alabama. I also represent the 19% that take their lives, that are part of a need that we are working to meet. If I were not here today, I might be at a town hall. I might be speaking to a veteran, trying to find him home, transportation, food, or any other number of needs that they may have. The benefit of 988 and having it continue in full implementation ensures that I alone in our local department am not piecemealing what these individuals need, but rather they can pick up the phone, call 988, and know that the resources that they need are there, and without disruption, without having to revisit the funding issue every year, without coming back and pleading this case once again. Only about 30% of all veterans are involved in VA healthcare. That means that a lot of veterans are not going to see the advertisements, the encouragement to call VA or to get the help that they need from those programs, but they will remember 988. Almost 18% of those who die by suicide in Alabama are veterans. Only 9% serve in the state of Alabama. When the feds decided that 988 was going to become law, it was really very simple. Remember the 1-800 number I gave to you just a moment ago? Can you give it to somebody in need right now? No, but you'll remember 988, and you'll remember it tonight and tomorrow when somebody needs it. Of the 35,000 callers, 9,000 of them pressed 1 to be identified as a veteran and to get help specific to veterans' needs. We have learned that peer-to-peer work for veterans is the best way to help a veteran. Nobody understands a veteran better than a veteran. So we fully support this 988 proposal, and we'd like to see you all support it as well. Thank you so much.
Thank you, Ms. Lucas. Next up, Dave Hargrove, AT&T. Welcome, Dave.
Thank you, Chairman Reynolds and members of the committee. Thank you for giving me the opportunity to speak today. My name is Dave Hargrove. I'm Regional Director for AT&T Alabama. First and foremost, we want to agree with the other members of the wireless industry and others who might be here to oppose this bill that the purpose behind HB 389 is great and well-intentioned. We appreciate all of you who work on this issue every day and all these folks here in the audience who do so. My company believes strongly in a national suicide prevention lifeline. Our customers can dial 988 from their landline, mobile, or voice over internet protocol phone to access crisis care support quickly. Now, why is this important? As we know, the United States is experiencing a crisis, and we want to be part of the solution. And according to the Centers for Disease Control and Prevention, symptoms of anxiety disorder and depressive disorder increased considerably in the United States during the last 5 years. In response to these trends, back in 2020, our national team at AT&T worked with the FCC and Congress to designate 988 as an easy-to-remember code for Americans to reach that lifeline. However, we would encourage this committee to fund 988 through the general fund budget as opposed to imposing a new tax on telecommunications consumers. As filed in the bill, this new fee or tax would amount to approximately $70 million annually if imposed at 98 cents per line. None of our peer states in the Southeast impose this tax, not Mississippi, not Georgia, not Tennessee, not Florida. As Jake mentioned, only 5 states do impose the tax: California, Colorado, Nevada, Washington, and Virginia. Again, 988, a wonderful tool, but we'd like you to consider funding it differently than is stated in the bill. Thank you for the opportunity.
Thank you, Dave. Next up, Chris Reeder with Aaliyah.
Good afternoon, members of the committee. Thank you for allowing me to speak on behalf of the bill today. My name is Chris Reeder. I'm the Director of Governmental Affairs for Aaliyah. For the past year and a half or so, we have been actively engaged on the 988 Commission with the Department of Mental Health, developing the 988 Commission and the mission of the 988 number. Law enforcement's the last resort for citizens of Alabama. You call 911 when you don't have anyone else to call. And as well-trained as our police officers are, as well-trained as our state troopers are, they will never be as well-trained in mental health as a mental health professional. 988 gives the opportunity for an individual in a crisis to get the best help that the state has available. Because of that, it will help law enforcement in terms of our workload and in terms of being able to assist the state in the best way possible. It helps mental health professionals assist individuals who are in crisis in the best way possible. It's not to say that 988 and 911 are two separate divisions. Law enforcement's always here to support 988, but 988 gives law enforcement the additional tool to help citizens of Alabama, and that's why the Alabama Law Enforcement Agency is fully in favor of the 988 Commission. Thank you.
Thank you, Mr. Reeder. Justin Bailey, ACBA.
Mr. Chairman, members of the committee, thank you for allowing me to be here today. Again, I am Justin Bailey with the Alabama Cable and Broadband Association. A number of my members provide land, business, and mobile services. I, along with everyone here, understand this important issue and that it should be addressed and will be addressed. The members of my association support the creation of the 988 line, but have significant concerns about the bill's funding mechanisms. I want to thank the chairman and members of the Department of Mental Health for working with us on technical issues related to the bill. However, we've just received this updated version of the bill, and for some of my members, these changes would represent a significant change to their business processes. At this time, we believe that the weight of the issue requires study to maximize the efficiencies for the service provided, and we want to be a part of the implementation of 988. 98 cents per month per line is more than double that of the highest state of the country, and the impact that this fee will have on our customers and taxpayers deserves to be studied comprehensively before being placed on our citizens. As mentioned, other states have addressed this 988 system without a new tax. Again, I want to reiterate that our member companies want to be a part of this process to best implement this most important life-saving system. We believe that more time is necessary to ensure that taxpayer dollars are being spent in the most efficient manner and look forward to continuing to be a part of the solution.
Thank you, Mr. Bailey. Next up, Leah. Ms. Ledine from Alabama 911.
Good afternoon. Mr. Chairman, I'll take your advice to heart. I won't repeat a lot of what everyone said, but 911 has come up in the commentary of most of the folks that have spoken. I'm Leah Misseldine, the Executive Director for the Alabama 911 Board. What I'm here to say to you in support of 988 in Alabama, 988 and the road they have ahead of them is not unlike 911 has had for the state of Alabama. And what I will tell you, and to the point of perhaps Alabama having one of the top 5 911 fees in the state, we also have one of the most resilient, repetitive, redundant 911 systems in the state. We are on our way to certifying every person that answers a 911 call in the state. We have deployed a network that has a statewide text capability. We've been able to do all of those things through that sustainable funding model that you mentioned earlier in that crisis that we had 10 years ago. So I'm here to tell you that, like I said, 988 is not unlike 911. And the funding model, as well as the technology and the care that we provide, is going to be a course that we would like very much to walk with 988. We have lessons learned. We do not want to duplicate technology. We do not want to duplicate cost. We want to support them in this mission of providing the best possible care to Alabama, and we look forward to doing that.
Thank you, Ms. Misha Emmett with the Alabama Foundation for Suicide Prevention.
Good afternoon, everyone.
Good afternoon.
My name is Misha Emmett, and I'm the Area Director of the American Foundation for Suicide Prevention Alabama chapter. AFSP is the leading national nonprofit organization exclusively dedicated to saving lives and bringing hope to those affected by suicide. As the nation's largest private funder of suicide prevention research, we know that suicide is a leading yet preventable cause of death and a public health problem. State support for and investment in crisis support systems and call centers within the Lifeline network is critical. While the Lifeline is a national program, federal funding is minimal for each center and largely goes towards managing call routing, best practice standards, public messaging, and technical assistance. Local crisis centers therefore rely on funding from state and local contributors to operate and grow. Alabama must invest in our local crisis call centers and the continuum of crisis services that can support callers needing an in-person response. An appropriately resourced 988 system consists of immediate access to an effective and coordinated system of suicide prevention crisis services. Crisis call centers are the hub of this integrated system, which also includes access to mobile crisis teams and crisis stabilization centers. A 988 crisis services system that is effectively resourced and promoted will reduce healthcare spending with early intervention, reduce the burden on emergency rooms and law enforcement, and improve outcome for individuals experiencing a suicide or mental health crisis. It will also ensure equitable access and fill gaps in the current crisis response system, particularly those that affect rural and underserved communities. Simply put, we all have a role to play in preventing suicide. And with your support, passage of this legislation will affirm the state's commitment to improving the lives of Alabama's residents and their loved ones, and to preventing the tragic loss of life to suicide in the future. The AFSP Alabama chapter is grateful for your consideration of this critical bill and strongly urges your support. Thank you for your time.
Thank you, Ms. Emmett. Is Sheriff Cunningham here? Sheriff Cunningham with the Sheriff's Association? Okay, we'll move on and save if he gets here. Holly McCorkle, Alabama Council for Behavioral Health Care.
Good afternoon, representatives. My name is Holly McCorkle, and I'm the Executive Director of the Alabama Council for Behavioral Health Care. I represent 20 community mental health providers across the state and all of the providers who are currently responsible for answering the 988 calls. As you have heard, the 988 mental health crisis line was established and signed into law by President Trump in 2020, and the federal law authorized and anticipated that states would eventually collect fees to build out the 988 system moving forward. Callers to 988 have ranged as young as 12 to the elderly, from homeless to CEOs. One of the very first calls to a 988 call center was a female CEO who was planning her suicide. A 988 counselor was able to help her develop a safety plan, which included talking to her significant other. There was follow-up the next day, and the caller reported that the conversation with her significant other was life-changing. She planned to seek treatment and felt that she was going to be able to overcome her depression. Another example, a caller called 988 and was actively contemplating suicide. Due to the nature of the circumstances, Co-Response was deployed. Co-Response is a trained mental health professional who accompanies law enforcement. When they arrived, the mental health professional was able to de-escalate the situation, and they brought the individual to a crisis center for treatment. These are not anecdotes. These are actual Alabamians whose lives have been saved. Their lives were saved because y'all, as policymakers, decided to invest in crisis services. This is a quote from a 988 counselor. The most rewarding and difficult calls are the active rescues, and we've had a number of those. Getting assistance to someone who has already taken action to end their life is at the moment a difficult thing to do, but then you realize you have just saved a life. Having a phone number to call is essential for people who need help, but it is not enough by itself. As it stands, residents in only about a third of Alabama counties currently have access to a local crisis center or mobile crisis team. You may have heard criticism of the fee. However, we view this fee as a fiscally responsible approach to meet a serious need in all of our communities. This bill would allow us to ensure that some level of 24/7 crisis services are available in every county. For example, the Crisis Center in Mobile has been operating since May of 2021, and they calculate they've saved their community $17.8 million. That's over 1,500 people being diverted from inpatient psychiatric hospitalizations or involuntary commitments, over 1,600 people being diverted from hospital ERs, 419 people being diverted from arrest, and 941 people being diverted from an ambulance transport to hospitals. As you can see, the 988 Act is not only fiscally responsible, but ensures that Alabamians in every county, all the counties that you represent, will not only have a number to call in crisis, but will also receive an appropriate life-saving response. Thank you.
Thank you, Holly. And last on the list, Mark Wilkerson with the Broadband Association of Alabama.
Thank you, Mr. Chairman, members of the committee. My name is Mark Wilkerson. The association I'm here on behalf of is the Alabama-Mississippi Broadband Association, which represents rural providers throughout the state of Alabama and Mississippi. I want to commend Ms. Missledine and what she said about the Alabama's 911 networks. We agree with that. We were at the center of the 2012 revamp of Alabama's 911 statute to provide a sustainable, across-the-board, across-technology platform to collect fees to support Alabama's 911 network. We were also active in a 2014 amendment to that statute to further clarify the application of the charge to certain digital connections that are provided to large business customers. The lesson from that process, and I think the lesson before that through litigation in Alabama's old 911 statute, is that the devil is in the details as to how these charges are applied. The bill, as we've seen, adopts much of the language of the Alabama 911 charge, but not all of it. For example, the 214 amendment I mentioned, applying to digital connections to large business customers, wireline customers, is not in this bill. And it creates a separate agency, the Department of Revenue, to collect and interpret the statute, as opposed to the 911 board, which was set up in 2012 and has had experience in applying and interpreting and collecting the fee. If the legislature were to adopt a fee-based approach to support this service, We would encourage it to streamline it so it mirrors the 911 charge. So there is clarity to providers as to exactly how they apply that charge to connections. And we would suggest perhaps the simplest solution would just be another line on the forms that are already used to pay 911 fees into the state. That would be the simplest and most streamlined way, we think, to collect any fees that were to support this. Obviously, the 911 board would need to be compensated for any additional costs it would incur. But I think that would be a simplified way and the most efficient way and a most taxpayer-friendly way of applying a fee here. Thank you for your time.
Thanks, sir. I appreciate that. And I think we have involved your language into the sub. Ms. Hall, do you have a question?
Oh, well, if you've involved all of the things that he just talked about?
Well, I believe we did, and like I said, we're not going to introduce the sub today. I know at least from the cable providers, I kind of heard some comments about maybe some other technical language that I thought we had taken care of there, but we'll certainly go back and look at that. Did Sheriff Cunningham show up by any chance? Go ahead, Ms. Hall.
Oh, those recommendations I just heard made sense, and I haven't really gone through the sub. So if you are saying that you've looked at all of these, and we've had discussions on all of these, but we're not voting on this today.
No, ma'am, we're not, and I'm not going to introduce a sub, offer the sub to the committee because there may be some additional technical language we need to address based on the comments today. But I do think and certainly appreciate 911 coming forward and working with the team on the collection of those fees, and I think that mimics the comments at the mic today.
The part that deals with
Sorry, go ahead.
So he said a couple of things. So I'm just trying to the streamlining it with the clarity of changes. Clarity of charges.
Yes, ma'am. The collection of the charges. Yes, ma'am.
Okay.
To be consistent with 911. And I might ask the commissioner to step to the microphone, but I believe we've got a structure that they would actually collect those fees for mental health, correct?
That is correct. 911 has agreed to collect those fees on our behalf.
Thank you.
Sure.
Well, okay. I'll just wait.
Any other questions? Representative Witt?
Yeah, thank you, Mr. Chairman, for acknowledgement. A lot of numbers have been thrown around this morning or this afternoon, and we were challenged to remember a number earlier, and I wrote that number down. But I'd also like to challenge everyone here to remember a number. It is 712. 712. 712 this morning, I received a phone call, and I received it from my son, and I could tell he was distraught. And he told me that one of his friends had committed suicide last night in Huntsville, Alabama. I was there, Representative Reynolds, you were too, when I received that call. But I answered that call because I was there to be able, because I was his dad, to answer the call. In the suicide note, without going into great detail, the young man, the 22-year-old, felt that he couldn't speak to anyone. He couldn't find anyone to talk to. He felt alone. He'd moved to Huntsville and didn't have any family. And he felt like he couldn't go on, and he took his own life. I was there to answer my call at 712 this morning, so please remember that number, and please remember that family. Thank you.
Thank you, Representative Witt. Any other questions, comments? Yes, sir.
Thank you. I was wondering, how do we come up with the number, the 98 cents? And because that seems to be what a lot of the conversation is around. And if it's different in other states, just kind of, is that a per capita number? Or like, how do we come up with the 98 cents?
Certainly, Ms. Boswell, if you want to answer that, but there's a budget behind it. Yes, sir. Go ahead, Ms. Boswell.
Yeah. So that was part of the work of the study commission, the 988 study commission. As you've heard mentioned today, we've been in the process of developing the Alabama Crisis System of Care. And so once we realized that those services were working, that they were saving lives, we began to look at what would it take to have these services statewide in Alabama. And so right now we have funding for 6 crisis centers. We looked at cities with a population of 50,000 or more as cities that would need a crisis center. So it would take us from 6 crisis centers to 11 crisis centers in the state. We also looked at rural communities and the number of mobile crisis teams that we would need around the state. We also looked at the call capacity. Many of you probably maybe never heard of 988 before this week. Part of that is because we haven't broadly advertised it because we need additional staffing and additional capacity at our call center. So a big portion of that is looking at what it would take to get to full capacity at our call centers, knowing that the minute we start advertising this number, the calls are going to go out the roof. And so that really was the work of the study commission. We presented that to them and worked through with them how the money would be allocated to the Alabama Crisis System of Care.
Thank you. And so this would cover the additional centers and like the teams or whoever that would, okay.
Right.
So the response teams and stuff.
So the mobile crisis teams
Right,
that
the
we
mobile
talked about earlier, that can be deployed in co-response with law enforcement or can be deployed if someone's just calling 988 and they need someone to come to them.
Okay, thank you. Thank you, Mr. Chairman.
And on that note as well, just a comment about the proposed sub that you'll see in committee later. We did remove the $3 multiplier that had some concern related to that. So it's a fixed budget. Yeah, it was an additional $3 match, right? Max, yep.
The sub is in the packet now.
And you do have a copy of the sub. We're just not going to introduce it today. Yes, sir.
My question, Mr. Chairman, is what's the mechanism that governs it from going from 98 to the maximum of 3?
Well, it's no longer an issue. We removed it from the bill in the sub. Thank you, and we'll, if it pleases the committee, we'll move on now. We've got bills to hear today, and thank you for listening through that. You see the concern, and certainly it touched home with one of our members today as well. And Ms. Harper, I would ask you to call SB 189 first as we move forward.
Senate Bill 189, Medicaid circumstances for revising reimbursement rates to nursing facilities, revised.
Senator Albritton.
Senator Albritton.
Yeah. Senator Albritton, I know he gets preferential treatment, sir, while you're working on our general fund. Sir, you step right up here. Is there anything we can do for you?
Thank you, Mr. Chairman. You're a wise chairman. It's
good to see you
all
today.
others, I can tell you. Thank you for having me. Today's bill, SB 189, deals with circumstances in Medicaid. This changes up the matter statutorily so that the Medicaid agency, let me go back and say, during COVID, when there was difficulties going on, people would the nursing homes and others would reach to their cap that they could do on certain matters, and we had no means or methods to be able to change, to adjust for that. This bill allows Medicaid to adjust under those circumstances when there's emergencies and conditions, and it gives them that means to adjust that when necessary. Now, the director is here for any other particular questions if you have any.
Any questions? Do I have a motion? Motion, a second? Second, Representative Lee. All in favor say aye. Aye. Opposed? Your bill has a favorable report, sir.
Thank you, Mr. Chair.
Thank you.
Thank you, body.
Ms. Harper, next bill.
House Bill 189, Alabama Forestry Commission establishes Rural Logging Support Act, funding supporting rural economic development, distribution of state license tax of public utilities.
Chairman Lovren, welcome.
Thank you, Mr. Chairman, members of the committee. Thank you for your work on the previous issue. That's an important one to all of us. So thank you. I'm here to talk to you today about the Rural Logging Support Act. I've spoken with rural caucuses and many of you individually, and if you will allow, Mr. Chairman, I'll talk briefly about the bill and then the substitute that I'd like to offer. We have the second largest industry in the state in forestry. It sort of exists behind the scenes. It's important to a lot of rural areas, and there's rural parts of all 67 counties that are impacted by the lack of efficiency to be able to move forest products from the forest to the mills, and then from the mills to the end users for those products generated. When we spend a lot of money on infrastructure, we start sometimes at the most populated areas and work our way from those. In a lot of areas that impact the forest industry in our rural areas, we'll never make that list of priority, especially when it comes to bridges. The primary purpose of this bill is to establish a funding model to where we could start addressing by priority some of these rural bridges that may not ever make the list. So if you will, you basically would start at the bottom and work forward based on some applications through county commissions. And the purpose of that is to try to increase that efficiency, to create the shortest path for our products to go to and from the mills. We looked at several different ways to try to find a funding model, and just as the industry exists, as said, behind the scenes, they didn't want to supersede any other economic development things going on that affect things that we're doing to grow Alabama. And so it kept rolling over to different issues and different funding models that we looked at. And so now we've come back to a substitute, and with that substitute bill, we'll take away any direct funding. It will basically just establish a fund through the Alabama Forestry Commission where it'll look at trying to find ways to fund applying grants to people that would like to address those rural bridges through our county commissions in these rural areas. So all the substitute does takes away any of the funding language that was based in the original bill and just establishes that fund through the commission that will be set up where 85% of that would be to go towards grants for those bridges. 10% will fund the support of the logging workforce to try to train people for that industry, and a 5% administrative cost to the Forestry Commission. So that's the basis of the substitute.
Thank you, Chairman. So we're on the substitute. Is there any questions by the committee?
Thank you, Mr. Chairman. Now, and mine is in terms of the funding, I guess dynamics itself in rural areas, you know, when you're talking about grants, is this the 100% grant process, or is it going to be some sort of matching issue?
Well, this would be basically empower the Forestry Commission to establish some rules and look at exactly what you're talking about. What level of grants? Is this going to be 100%? Is it going to be partnered with other options? And the purpose of substitute is to take a step back, establish this mechanism and this foresight through the Forestry Commission, and then try to find the best ways forward. One, to find funding, and two, to help assist in these rural areas. Whether it's 100% funding of bridges. Let's say the average cost for a rural bridge is $500,000, and then if you find $10 million to be able to fund it, then that's 20 bridges. And if we could just start hitting a few bridges per year, we could make a huge impact in our rural areas. Because this is rural economic development. When you have these industries looking where they want to place a major manufacturer in the forest product industry, first thing they do is plot out how we're going to get products in and out. In our rural areas, it's a real impact because of these bridges. And it's just no fault of, they're just forgotten about on the wayside sometimes because they're not the most highly traveled. So thank you.
Follow up on that. And I agree with you because we have several bridges in my area that school buses can't even go across because they have been deemed unsafe for school buses. And one in particular, because I got a call regarding how could we help get some funds for it. There was a large tract of land that was the people wanted to cut, but you couldn't even get the trucks. with all the equipment and stuff down into that area. It's, so that's one of the reasons I signed on to this bill as a co-sponsor. So thank you.
I appreciate your support. Just on a personal note, my family, when we have an area where we have to move a combine many miles out of the way just to get to harvest product because we can't get across the bridge the shortest route. So appreciate your support.
Thank you. Committee members, Ms. Hall?
What are some of your thoughts in terms of what a stable funding source would be?
Well, we looked at the utility tax that wasn't attached directly through the budget process. It was some of it was automatically going to mental health, but there was another percentage out there that was not allocated. And then through the research, we located that it was some rollover funding where if some incentives maxed out, it could roll over and draw from those funds. And so we looked at how much money would be there. Certainly the forestry industry wanted to be there in the background and only if funds existed. But with the way the grants kept expanding, there may get to a point where those funds aren't there. So now the thought process is let's make sure to get our processes in place. Let's take a year to look and try to identify a responsible funding source and then come back next year and work towards finding that stable funding.
So you indicated under your grants that you would ensure that they didn't discriminate based on et cetera, but on number 5, on page 4, number 5, line 95, you created an advisory committee that will, and I would also recommend the language that will reflect racial, that page 4.
Okay.
Line 5. That I would recommend adding, creating an advisory committee that would reflect gender, race, disability, whatever the language that we generally use in.
If the committee so sees today that I would agree to that, working with that language on the floor if y'all see fit to move forward today.
I don't mind moving forward as long as we get it on.
Yes, ma'am. Well, I'll work with you between now and then to if we're so fortunate to do that. Be happy to.
Thank you, Ms. Hall. If there's no further questions, we're back on the sub. Do I have a motion? Move.
Second.
Second. Representative Lee, all in favor say aye.
Aye.
Opposed? Sub is adopted. Back on the bill.
Motion to adopt this.
You got a motion by Representative Lee, second by Representative Chris Sales. All in favor say aye.
Aye.
Opposed? Mr. Chairman, thank you for working with all the organizations in forestry. Appreciate the work y'all have done on this.
I appreciate you, Mr. Chairman, members of the committee. Thank you.
Next bill, Ms. Harper.
Senate Bill 99, courts increase the mileage reimbursement rate received by jurors.
Senator Gavan, welcome.
Thank you. Good afternoon. Well, folks, it's pretty pitiful what we pay our jurors, a nickel a mile and $10 a day. Good luck getting a lunch in Huntsville for that. Yes. And, some of these folks have to drive a long way, and I think we're over 60 cents a mile now for the federal rate. We did change this a little bit from the way it was first pitched, and basically to allow, rather than us to have to come back time and time again and adjust it, let's let the Supreme Court do it, and it's going to come out of their money. So, Senator Albritton all of a sudden let it get out of committee. So, but when he thought he was going to have to pay for it, it was a little problem. So it's going to have to come out of their budget. I'd be glad to answer any questions.
Thank you, Senator. Any questions, members? Have a motion? Second by Representative Witt. All in favor say aye. Aye. Opposed? The bill receives a favorable report.
Thank you very much. Y'all have a great day.
Next bill, Ms. Harper.
Senate Bill 178, Department of Veterans Affairs, additional benefits for spouses of those who were killed while on state active duty status.
Representative Starnes.
Yes, sir. Good afternoon, Mr. Chairman and committee members. SB 178 is Alabama National Guard bill. Under existing law, educational benefits are available to spouses of deceased or totally disabled veterans or those who are a prisoner of war while serving as a member of the United States Armed Forces. This bill will expand benefits to include the spouses of those who were killed while on state active duty status or whose death results within 3 years of injury sustained while on state active duty. And basically what this bill is once a guardsman gets activated, they're on state orders, like reacting to a hurricane, and then you get federalized under Title X. So this is just covering that gap and giving the opportunity for the spouses to have educational benefits if they're killed while on state duty.
Thank you, Representative Starnes. Any questions by the committee? Entertain a motion. Representative McCampbell, second. All in favor, say aye. Aye. Opposed? Thank you, Mr. Starnes.
Thank you, Mr. Chairman.
A favorable report.
Thank you, sir.
Next bill, Ms. Harper.
Senate Bill 174, school security personnel and school resource officers to amend section 16-1-44.1 Code of Alabama 1975 to provide further for the compensation of retired law enforcement officers providing services as school resource officers.
Senator Orr, we're spending the day together.
Yeah, we have, Mr. Chairman. Thank you, and members. So this bill started off more narrowly, and we were trying to address the shortage of SROs in schools by expanding the ability for them to make money a little bit over the cap for their overtime hours. The chairman has a substitute that will expand this bill and include corrections officers and basically raise the cap for SROs and COs to $52,000. And that's the sum and substance of the substitute, I think, Mr. Chairman. You may have some comments.
No, thank you, Senator. And I do offer the sub, and the sub simply expands that to additional categories related to those returning to work as corrections officers with the Department of Corrections. And then it also amends the language to include all hours of the day for law enforcement for those returning as school resource officers. And we have with the 52,000 cap comes into play there, just as it was in our original bill, and then certainly a sunset of December 31st of 2027, because we hope this is a temporary problem. You know, we just don't have the available workforce. We want to entice those quality workers back into the workforce. And, you know, currently they're under that $37,000 cap. This raises that. And, you know, as many of you heard me say before, you know, our retirees can literally go across the state line and work in Georgia or go to private industry, and there is no cap at all. So certainly we're keeping those people in our neighborhoods.
What?
Yes, ma'am, that's all.
When you say, you're saying perform duties as school resource officer or as you're doing both, the school resource officer and the
corrections officers.
Okay, all right.
That's for the huge deficiency in personnel within our corrections department. Yes, sir.
I guess this is more probably a comment than a question, but I know we've had a bill in the past that we've moved through because we have a shortage in many different areas. And this, I know it expands, so I commend you on the work that you've done on this with our school resource officers and correctional officers. But I feel like at points, especially in my district, we have a lot of people that travel across state lines that are working, some teachers that go into the private sector. We need to try to keep them in our public sector as much as possible. When we have those teachers, those qualified educators that are working, when we have the people that are working for our state, we need to keep them locally, keep them here in Alabama, and not lose them across state lines. And that's what a lot of them are doing. They're moving across state lines. They're moving to the private sector. Of course, we're all from North Alabama. We see what these people are going into Huntsville. They're leaving the public sector and going over there. So I think as we move forward, I think it's a great conversation to have, and I think it's something we definitely need to look at as we continue these conversations as in the needs of especially education in some of these other areas where we have those shortages. So thank you for your work on this.
Representative Kitchen, you're exactly right, and certainly we agree with you. And I appreciate Senator Orr working with us to expand the scope of his bill. And I think we monitor that going forward, maybe bring some measured outcomes back to this committee, and maybe in the future we can expand that to include all retirees. So we're on the, yes, sir, Mr. Lee.
What do you think the reason is? Is it because they're not paying into the retirement system, the reason we don't want to do that?
Part of
Is that the main
and
reason?
incentivizing people to retire, and we're back to a drop situation where I retire and then I go back into the classroom and I can now get my retirement and my regular salary. And so it's a real incentive if you've vested to retire and come right back.
Mm-hmm. Seems as though there could be something where it'd have a maximum years, have a number of years, and then also a contractual agreement that, yeah, we'll rehire you, but you're going to pay into the retirement system, and knowing that you're not going to do it, having a contract where you're going to pay in because you're not going to take a spot up for someone else that's going to pay into the retirement. And I mean, we can say all we want to, the retirement system's nothing but a Ponzi scheme, because of those that are literally working today are paying for those that retired yesterday. And we need those people working, paying in. So just a thought for that in the future.
And we certainly hope those full-time employees come and fill those slots. We all agree upon that. Any other questions by the committee?
Well, I was just trying to understand where are we making the differences, because it was already in statute that you could retire and come back and work and make, but we changed it to $52,000.
Well, that is still in place. It does not change any of that. Any other retiree not covered in this bill can still continue to come back to work for an RSA company, and they would be limited by that $37,000 cap. We are just specifically looking at these two classes of police officers serving as SROs and those serving as correctional officers.
They couldn't do that before.
Well, they could do it, but it'd be a $37,000 cap.
Well, they had the
Yep.
37.
Yep. This raises it 52. Okay, we're on the sub. Do I have a motion? Motion, Representative Witt. All in favor, say aye. Aye. Oppose? And back on the regular bill. Senator, any other comments? You ready to, do I have a motion? So moved.
You got an amendment. You got an amendment.
Okay, so I thought we had included that. I apologize. So that'd be my fault. So we do have an additional amendment to the bill, and there was just a typo there that was referred it to December 31st of 2026, and my amendment replaces line 160 on page 6 with the following subsection after December 31, 2027. So moved. Second. All in favor, say aye. Oppose? The amendment is adopted, and we're back on the bill. Have a motion? So moved. Second. All in favor, say aye. Aye. Oppose? Senator, your bill has a favorable report, sir.
Thank you. Thank you, Mr. Chairman.
Appreciate it. Thanks for working with me.
Thank you.
Yeah.
We want to roll the next one? Is that?
Oh, yes, sir. You go right ahead on
Then you can get shut up and
SB
get me out of
205.
here. All right.
I'll jump in front of Ms. Harper there.
All right. This is really we passed several years ago something called the Transportation Infrastructure Bank, and it's something I saw another state doing 4 or 5 years ago. And really the only change is in the back of the bill, where we're reducing the threshold from 5 million to 1 million. And what that means is a county that does not have, or city, that does not have a good bond rating can use the state's bond rating to get a much less cost for its cost of capital to do roads or bridges in its area. So if you're from a very rural county or have small towns in your area, in ALDOT's, this, work with ALDOT, and this comes from ALDOT's recommendation. They've got some small cities and some more rural counties, low population, that their bond rating would be helped by using the state's bond rating. But 5 million is too much for them to handle, and so they would like to drop the minimum threshold to 1 million to be able to participate in the program. So it comes from Director Cooper and a recommendation from ALDOT.
Any questions, members? Entertain a motion? So moved. Representative Lee, Representative Witt. All in favor, say aye. Aye. Opposed? Favorable report, sir.
Thank you,
Thanks,
Mr.
Senator.
Chairman.
Next bill, Ms. Harper.
Senate Bill 162, Board of Veterinary Medical Examiners, increased daily stipend for board members.
Senator Butler or
I'll
Representative Witt, thank you.
I'll care for Senator Butler. He's tied up in a committee meeting upstairs. Basically, committee members, this is increases the daily stipend for board members to the Board of Veterinary Medical Examiners from currently $200 to $400. The board has not had a stipend increase in 18 years and had some difficulty in recruiting new board members. There's no tax dollars involved here. And again, it's a minimum that costs $600 minimum veterinarians to find a replacement or someone to run their shop while they're down here in Montgomery meeting on a quarterly basis. So with that, I'll be glad to answer any questions.
Thank you. Any questions, members? Entertain a motion. So moved. Second. All in favor, say aye. Aye. Opposed? Bill receives a favorable report.
Thank you, Mr. Chairman. Thank you, members.
Final bill, Ms. Harper.
Senate Bill 129, Commissioner of Corrections designated a law enforcement officer by virtue of office, Commissioner and Deputy Commissioners of Corrections with APO certification retroactively designated correctional officers or law enforcement officers for state retirement purposes.
This is Senator Singleton's bill, and I agreed to handle it in committee today. And Ms. Harper did a great job explaining it to you, and then simply both those in that existing position. So moved. You got a second? Second. All in favor say aye.
Aye.
Opposed? Do I have a motion to adjourn?
Motion.
So moved. Thank you, members.